There will be several major trials presented at the European Society of Cardiology, so it's going to be a very exciting meeting. The AAA trial examining aspirin in patients with asymptomatic atherosclerosis will be presented, so we'll have some more data about aspirin in, I guess you could call it, high-risk primary prevention. Another trial, Coronary 7, will be presented that's got two parts. One part looking at what the right dose of aspirin might be in acute coronary syndromes, and the second part examining what the right dose of clopidogrel is in acute coronary syndrome patients undergoing PCI. The RELY trial will be presented examining dabigatran versus warfarin for atrial fibrillation. So lots of new data about antithrombotic therapy. Plato will be presented as well. A press release has already been issued regarding the primary results, but that's the trial of ticagrelor, a novel ADP receptor antagonist, versus clopidogrel across acute coronary syndrome patients. The active trial will be presented, and the part that will be presented this time is that having to do with angiotensin receptor blockade versus placebo in patients with atrial fibrillation. And another major trial that will be presented, where a press release had already been issued, will be the MADE-IT-CRT trial examining cardiac resynchronization therapy. So lots of major trials with the potential to greatly influence clinical practice.
Have a question or comment about a CVN story? Send us an email at cvnfeedback@acc.org.